Hello, everybody. Welcome to another episode of the Lit Podcast Live right here on Facebook and YouTube. I am your host, Juana, and this is Mental Health Awareness Month, y'all. We are going to be talking about depression tonight. So, before we get started, hello, Mama. I know you was waiting on me. But before we get started, if you are on Facebook and you see the StreamYard, please allow them to access your name so that I can see who you are. Um, because they're not using your data. It's their privacy. So they just want you to connect so that we can see who you are. Okay, so you have to give them that permission. Otherwise, I can't see you. So I'm sorry. It's just what it is. But welcome. So tonight we are going to be talking about depression because I think sometimes people walk around and don't even know they're depressed. So I know it's such a common thing and we say it all the time, not really knowing what that means or what that really looks like. But I want to really get into it today just so that we can have some better understanding of what it really looks like. Because sometimes, you know, you may be depressed and not know it. And so I do also have a depression screening that I can share with you in case you would like to look, take one in your own privacy. Um, Tonight, this is not sponsored by any means, but I do like to use Mental Health America's website because they do have a lot of different resources and like screening devices or screening assessments that you can use yourself. Okay. And so I know we got about 2 more minutes before we can, I'm trying to let people come on in. But while I'm sitting here, I'm going to go ahead and do a quick little advertisement. So I have a t-shirt on. It says support mental health awareness. And it was made by my mother-in-law who is here visiting me today. So I'm really excited. It's a really comfy t-shirt. It has like that little form fit to it, almost like a dry wicking, but it's really soft material. But she makes t-shirts, and so if you'd like to get a t-shirt of some sort, she makes them all. You can reach out and contact me, and I can link y'all up. Hey, Doc Brian Fitzpatrick, coach. He said, "What's cracking, Doc?" Y'all, I just got in this morning from Texas at 1 o'clock in the morning, and we traveled with both of our dogs. So that was that's what's cracking. I don't know. I'm just like, am I alive? Am I walking? Am I awake? What's going on? But I guess we'll go ahead and get started so we could talk about this question: am I depressed? And so when you think about depression, I was talking to my daughter about this one day. And, so this is kind of how this topic came up that we were supposed to do last week. But I guess I should tell y'all. So I bought a new car. That's where I was. It was taking a little bit of time. So I got me a new ride, y'all. I'm whipping in a Toyota Highlander. So I just upgraded my RAV4. So anyway, God is good, and I'm just thankful that I was able to get it, and it already got 2,000 miles on it because we drove it to Texas. But anyway, so we're going to talk about this. Am I depressed? So as I was saying, my daughter and I were talking about it because, she has a good awareness because obviously she lived with me, right? A whole therapist, but then also because she's had to take her own classes as a teacher, and so she had to take some psychology classes. Hey, Nikki, what's up? But she was talking to me and she was like, I think sometimes people are actually depressed and they don't really know it because when we think about depression, what comes to your mind? And I mean, feel free to put it in the chat. What comes to your mind when you think about depression or when you hear that somebody's depressed? So I know there's a delay, but um so sometimes when people think about depression, they just think somebody's just like laying in the bed, um not getting up, not really interacting, just like not able to do anything, right? Hey honey, my husband is there. Oh yes, Nikki. Thank you for putting something in the chat. Cause y'all know this is what I like. This interaction. So seclusion, right? So like you think of somebody just being shut in and not going anywhere. Is that what you're talking about? Because that does happen. So I think what happens is that we think of more forms of severe depression rather than maybe what somebody would consider to still be functional. And so I'm going to talk about that just a little bit because nothing about depression is normal, right? You should not normally feel any of those like ways that I'm going to describe it here in a moment. But so nothing about that is normal, okay? But there are times when people learn to function and still do. I know y'all have heard of like functioning alcoholics. Well, there's people with functioning depression. Like they're still up and about and they're still going places and they're still doing things. It's just it might just look a little bit different or it might be very limited. Yes, Damon, thank you. A lack of energy. That is a symptom of depression. So let's go ahead and start talking about what actually is depression first. Okay. So depression is basically a mental health uh, a mental health diagnosis that people can get. Um, so let's go back for a second and let me get some of my thoughts together. So basically depression is a clinical diagnosis that people get, right? And so what I was saying is we just sometimes just casually say it like, oh, I'm depressed or you must be depressed or something like that, but it's actually a clinical diagnosis. And there are different types of depression, okay? So different types mean different symptoms, right? So something I want to share are some basic facts about depression first before we really get into it. So, major depression is one of the most common mental illnesses. It affects more than 8% of American adults each year. So that's 21 million people that they're saying. But remember how I feel about statistics that they're not really accurate, right? They're because it's a good way to kind of gauge some things, but it's only about who reports. So think about all the people that do not report depression. And so, or depressive type symptoms. Okay. It also says that 15% of our youth, so that's 3.7 million people, ages 12 to 17 are affected by major depression. And I forgot, that's what I'm going to be talking about is major depression. Okay. Um, I'm going to mention some of the other types of depression, but we're going to be focusing on major depression. Depression causes people to lose pleasure in daily life. It can complicate other medical conditions, and it can even be serious enough to lead to suicide. And so sometimes that's what we think about is like people having those suicidal thoughts. They're just so overwhelmed that, we kind of associate depression and suicide, right? And this is, again, these are severe types of issues that we're talking about. Um, and I also want you guys to know that, you know, there are certain risk factors that increase your chance of developing depression. Okay. Granted, it can affect anyone at any age. It's not a racist. It's not, depression can affect anybody. It does not matter. Right. And it can affect any ethnic group. So depression is never normal. Remember, I've said that it's not a normal part of life. Okay. If you're walking around and you feel like Damon was saying, low energy, or like Nikki was saying, you are secluded, so you're isolating yourself. That's not normal. Okay. It's not normal. We are put on this earth to engage with other people. We were not put here. We were not meant to be alone. Okay. So when you start to feel some things that I'm going to go through the symptoms, I promise. But if you start to feel those things, they're not normal. Okay. I just want you to keep that in mind. That's why I keep saying it ain't normal. Um, and so I want you to know that it is hope for depression. It can be treated. It's and you don't have to have it forever, right? There are times where maybe your treatment is not as effective, or there's just a different circumstance that comes back up that kind of like re-triggers it in a sense. Okay. um, this statistic says only about a third, which is 35% of those people suffering from severe depression seek treatment from a mental health professional. And that's bad because, before I became a therapist, I was in the military. And, and it reminded me when I saw my friend Nikki on here, right? She is a lab tech as well. And I know y'all remember Nikki. She came on, she was the very first person to do the live. So that was last year. So yeah, a whole year ago. But sometimes we would have these microscope samples, especially of women, I'm just saying, and where they would go and get their back then it used to be annual. Now I think you can wait like 3 years before you get a pap smear. And that's, if you don't know what pap smear is, it's when they check your insides as a woman. And so sometimes we would get a sample and it would be raging with bacteria or other things, right? And I'm gonna just leave it like that for people that are sensitive. um and we're like, man, this is crazy. How could you not feel this and think that this was okay? Because, some of the stuff that we would see, I'm sure it was to cause symptoms, at least smell like something, right? So it's like, how do people wait so long, or why do people wait so long before they would come and get treatment? Because, you could have nipped that in the bud and you wouldn't have had all these other problems. Well, sometimes it's because of embarrassment, right? That, if you are a woman or even a man and you are going in for health checks or health screenings and things like that, you're scared. You're scared of what they're going to say, or you're embarrassed about what it might be, because then there's other questions that have to be answered. Well, it's kind of the same thing with depression or any other mental health, mental illness. People are sometimes embarrassed, so they wait. They think it's not really them, so they wait and before it gets so bad. And when it gets so bad, that's when they reach out for help. So I'm gonna share some of these symptoms with you because I don't want you to wait that long. Okay. Um, but I want you to also know what can cause depression. Okay, so when we talk about the major depression, it can be biological. So some people with depression might have too little or too much of certain brain chemicals in their brain. They're called neurotransmitters. And so changes in these brain chemicals can sometimes contribute to depression. And so if sometimes like if there's a physical, I guess it would be called a physical illness, like I have a thyroid dysfunction, right? There's links to that, and depression. If you have a low vitamin D, it can be related to depression. Okay, so sometimes it could just be something, a hormone or a chemical in your body that causes the depression. There's cognitive reasons that people could have depression, which are cognitive, is like thinking things. Okay, so there's negative thinking patterns and low self-esteem. They are also likely to cause, to be related to developing clinical depression. Mental Health America says that gender could be a reason. It's not clear why. They believe that it could be hormonal changes, but they say that women experience depression more than men. And so women do go through a lot more hormonal changes than men do, such as your menstruation, pregnancy, childbirth, menopause. Like, so throughout our whole life as women, we go through different ups and downs of hormonal changes, right? So that could be the reason, but it's still unclear. So they're still doing more research on it. Depression is also likely to occur along with certain illnesses, like I was saying. I just kind of jumped ahead of myself, but other illnesses such as like heart disease or cancer or multiple sclerosis or any other hormonal disorders, and even diabetes. So when you think about it, it can co-occur with pretty much any other type of illness that that you might have, because when you think about it, I keep saying that a lot, right? For some reason. But when you do think about it, it makes sense, because if you broke your arm, right, and you're not able to cook or clean the way that you normally would have, or write even, or just do the same things that you would normally do before you broke your arm, and now you're in a cast and you can't do those things, you're limited, right? You might start to feel down and depressed because you aren't able to do those things that you normally would do. So it could be, breaking your leg, arm, anything, or any other um, actual health, like physical health issue. Some medications have side effects that can bring about depression. And so you need to be very careful about that, and pay attention to side effects. And I know this is not about side effects, but pay attention to side effects, because sometimes there are medications, because all medications alter your chemical balance, right? So within your body. So, some things might affect your liver, but you're thinking, oh, I'm not that, I'm all right. Or it might affect your kidney, but some also affect your mental health. Okay. There are also genetic reasons, and because it runs in your family kind of thing. There's a family history of depression, puts you more at risk of developing major depressive disorder as well. And then obviously situational reasons, right? So difficult life events, financial problems, um, maybe you just are getting divorced or separated, or a death of a loved one. Those are all types of situations that could contribute to depression. Okay. So, some of the symptoms that, because I know that's what we've been waiting for, is to know if I am depressed, right? So, here are some of the symptoms, and I'm going to go over them, but then I want to share a little more insight about them. Okay. So, some of the symptoms: persistent, sad, anxious, or empty mood, like just not really having that, like, we call it being flat sometimes, like where people have like no emotion on their face. They're just like, I'm just present. There's nothing really. It's like an empty shell kind of. um, Sleeping too much or too little, right? Because sometimes we just think like we just sleep extra and we want to get that extra sleep in, but sleeping too much could be a sign. Or sometimes if you wake up in the middle of the night, or either have difficulty waking up in the morning, or um, you wake up early in the morning. Okay. Weight gain, Lord. So I'm not going to just stop at weight gain, but also weight loss. So just fluctuations in weight, right? You can have a reduced appetite or either an increased appetite. And either way, you're going to gain or lose because of the increase or decrease in your appetite, right? Um, this is one that you guys mentioned: loss of, or I think y'all did, loss of pleasure and interest in activities that you once enjoyed, also including sex, right? So sometimes it's the medications that you might be taking that causes decreased libido, but um, when you just have a loss in interest in activities, you just don't want to go and go do anything. Also associated with depression is restlessness and irritability. And it's more or less like irritability that is kind of like easily irritable, not just for little small things that don't even, you just get irritated for no reason, right? It seems like. And then you can be a little fidgety and like restless and need to get up and do something, but then you don't want to do anything, if that makes sense. Persistent physical symptoms that do not respond to treatment. such as chronic pain or digestive disorders. And so we call these somatic symptoms, okay? Because sometimes you have these digestive problems, right? And then, okay, but you don't have acid reflux, or you don't have irritable bowel syndrome, you don't have colitis or ulcerative colitis or any of those types of things, right? Or you just have pain and you don't know where it's coming from, and you don't have a reason to have this chronic pain that you just can't get rid of. You could be taking in the army they gave us Motrin, so you could be taking Motrin, you could take a leave, you could take all this stuff, but the pain just persists and it doesn't go away, right? So that's what they're talking about, that this symptom of pain or digestive disorders or any other symptoms, they just don't go away with even though you've tried to treat them. Another big one that we notice a lot is difficulty concentrating, remembering, or making decisions. Now, I know that that can be kind of just, coincidental sometimes, or just because we're aging. But when it's kind of like, you notice it especially along with some other symptoms that I've already mentioned. And so, see, we kind of take some of these symptoms and don't put them together. We just look at them like, oh, it's just that. Oh, I'm just not sleeping, I need a new mattress. Or oh, I just don't know why my stomach's been hurting, and you think it's something you ate. So we kind of minimize them and don't really pay attention to the symptoms, right? But all along they're kind of happening together. Also, what I believe Damon mentioned, this fatigue or loss of energy, just having that lack of energy, like, man, I'm just so tired. Like, it's not like sleepy, but just like no energy, no get up and go, right? Like your battery's just drained. And then feeling guilty, hopeless, or worthless. Those are some, those basically, like the worthless one and hopeless, when I get clients that start talking about they feel hopeless and worthless, it concerns me the most, because then there's thoughts of suicide or death that can go with them. It doesn't have to, but most of the time when I have people, that's what happens. They also have thoughts of suicide or death, even if it's not. And I want to clear this up too. When you can have thoughts of suicide or death that are not necessarily like you plan to go and do it right now, but it can just be, I'm driving down the street, I wonder what would happen if I just drove off this the bridge as I'm going into Columbus. I wonder what would happen if I would die, if anybody would be worried about me, right? Those are thoughts of suicide. It's not necessarily like you're planning to go do it, but it's you're having these thoughts. It's like suicidal ideation, right? So, um, or just constantly thinking about death. So I'm gonna put in the chat right now. Hopefully y'all can see it, but I'm gonna put in the chat the depression screen. Like, so I don't know if it will do it, if it shows up correctly or not. I can't see, but if it doesn't, I'll go back and put it on there, and you can take them at your discretion if you would like to do a depression screen, okay? Because it'll ask you some questions, and at the end of it, it will also suggest if you should seek out professional mental help. And so, Mama, you are saying some medicine makes you feel that way. Yeah, that's what we're talking about. Yeah, the medicine sometimes that we take can contribute to our our depressive symptoms. Okay. Now, something that I want to talk about a little bit more are in our so we have a diagnosing booklet that we use, and I know I'm going to go over just a little bit, but on time. But we use what is called a DSM-5, and now they have the -TR, okay? And so when I'm actually diagnosing someone with major depressive disorder, they need to have 5 or more of the symptoms, right? And so their symptoms say depressed mood most of the day, nearly every day. And these symptoms need to be present during the same 2 week period. So that's why people are like not thinking like, okay, I'm not really depressed, because you could go into therapy and then you don't have like 5 or more of the symptoms, right? That last for about the same 2 week period. So what happened, and then they also say that at least one of the symptoms need to be a depressed mood or loss of interest or pleasure. Okay. And then so if you don't have a depressed mood most of the day, nearly every day, you're like, I ain't depressed because it's not every day, right? And those meaning the feeling sad, empty, hopeless type of things. Then they also say that you should have a markedly diminished interest or pleasure in all or almost all activities most of the day. You see what I mean? So it's like they use a lot of the alls and most kind of words. So then you're like, yeah, that ain't me, right? Then they have significant weight loss, not just a little bit weight loss, but significant weight loss. And then like for the sleep challenges, they say it's nearly every day, right? Then the fatigue is nearly every day. So all of that comes up for them, right? But here's the catch: we can rate it as mild, moderate, or severe. So, mild meaning that you just have like 2 of the symptoms. You see what I mean? Moderate, like 3 to 5 symptoms, and severe, like 5 of those symptoms. So, you see, like you could have a depressed mood most of the day, just feeling sad and empty or lost and feeling fatigue. That's just 2 symptoms, but it's like for that 2 week period. Okay. So that's why it gets a little tricky, and why I'm saying that you could be depressed and not really know it. And then, it gets real technical, which I'm not going to go into because you can have it mixed with anxiety as well. Right. So then there's other symptoms that's going in there. It can, it can happen just during the seasons, which now I'm going to go ahead and explain to you guys about some of the other types of depression. So there's major depressive disorder, which I was talking about. It's the mental health condition characterized by that inescapable and ongoing low mood, that loss in pleasure. And so not finding enjoyment in things, wanting to just not be around people. And it has to be present nearly every day for at least 2 weeks. Okay. And then there's persistent depressive disorder, which it's a longer lasting form of depression. And it's like, it's diagnosed if the person experiences symptoms for at least 2 weeks. But we use that diagnosis when symptoms of depression are present on most days for at least 2 years. So this is like ongoing for 2 years. Okay. And then, but oh yeah, I need to add this. It doesn't reach the severity of major depressive episode. So it's just like persistent depressed mood, kind of like you have like a moderate depressed mood for most of the time, if that's a easier way for me to explain it. Then there's also postpartum depression, which my business group, like my group, we talked about that last week. And you can go back. I shared it. So you should be able to see that it was all about postpartum depression. And that usually starts after childbirth, and it lasts at least 2 weeks up to a year. Okay. Then there's premenstrual dysphoric disorder, also known as PDD. It's a form of premenstrual syndrome, and it's diagnosed when a woman experiences severe symptoms of depression, tension, and irritability in the week prior to her menstruation. Okay. So when y'all are talking about that PMS kind of stuff, it's real for people, and it really impacts their lives worse than you could think. It's like, and it just lasts for that moment around the period. Okay. And then there's what you guys may be familiar with, seasonal affective disorder, which is a mood disorder involving symptoms of depression um, during the levels of low sunlight. Okay, so during fall and winter, which we did talk about on a previous episode as well. And just for GP, depression is also a feature of bipolar disorder. So that's where you hear people having like the manic, real high episodes, and then the low episodes, which would be the depression. Okay. And one day we can talk about bipolar disorder as well. And so now that we know what major depressive disorder is, we know some of the symptoms. Is there treatment out there for this? Yes. But let me tell y'all that is very treatable. But like anything else, you have to be active in the treatment. Okay. You can't just be like, it ain't work. It does work. There is therapy that helps. What some of the most common treatments include antidepressant medication, which I know a lot of people don't want to take the medicine, and sometimes the medicine makes you feel worse. Um, then there's psychotherapy, talking to someone like me, or not just talk therapy, but there's other types of therapy that you can do for it. And then the combination. I'm a big fan of the combination, especially if you have a more severe depression, you're experiencing more severe symptoms, because sometimes the medication just helps while we're doing our therapy. Because sometimes you can be so depressed that you need the medication to help you to lift your brain chemicals back up, in a sense, right? So with the I am not, and I'm going to say this publicly, I am not a proponent of just taking medication, because it's just like a band-aid. And so when the medication is gone, then now you have no coping skills. You don't have any way to help yourself, right? You become dependent upon the medication. So I always believe in getting therapy that is not just medication. Okay. And so the choice of treatment depends on you. I am a brain spotting practitioner. And so I there's different types of therapy. So brain spotting is a type of therapy that you can use to help alleviate, it kind of gets to the core of everything. And I'll talk to y'all some more about brain spotting another day. But I know we've been on here, we're a little bit over time. I do want to do one more promotional thing. If y'all have any questions, you could go ahead and put them in the chat. If you're still here, you can go ahead and put them in the chat and I can try to answer them for you. But I want to, because my friend Tammy, y'all know Tammy from Titan Publishing, she's a publisher. And so I made my book. My coach Glendora, she's been on here too. She's fussed at me about having a journal at least, but also I have a perfectionist type of complex, that I need help with, right? Somebody help me. But I was working on it and I needed it to be this perfect book, right? I needed to have all the things that I needed to have on there, because why? I can go to my core thing, because my daddy, it's his fault. And I hope he turning around in his grave right now listening to this, that it's his fault that he was like, hey, my name is going on that. So you need, whatever you do and it got my name on it, you need to represent me well. Right. But then I thought about it. His name ain't on here. It say Lyles. So this is the Lyles family. I'm representing that. No, I'm kidding. But hey Lemuel, thanks for joining us. But this is my book. I think it's backwards, but it says, I am not my trauma. I am intentional. It's just a blank inside journal. But what I like about this is because on one side, I put that I am not my trauma. So that's where you can write in like what's really going on with you, and like, the problem that you may be having, even if it's not trauma related, but you could write that in. And then on the other side, I am intentional. And so it's like how you can overcome it yourself, right? So things that you want to focus on that's opposite from what that is, because you are not your trauma. So that's where that comes from. Okay. And in there, it has in the front of the book, it has a whole bunch of coping skills. And actually, I put in some resources that you could call um, for additional help or assistance, like the National Suicide Prevention line, which, by the way, if you are experiencing depression and you start to have suicidal thoughts, you can call 988. 988. That's all. Just dial 988. If you're a veteran, you can dial 988 and press 1. If you are Hispanic, they have a whole, you can still do it and call in to the same number. They also have additional number that you can dial. If you have hard of hearing, you can dial 711 and then 988 so that you can get the TTY line. And I also have some other lines on here, like this National Sexual Assault Hotline and just a few others. But, it's blue, got my butterflies on it. So, Tammy, I hope you're happy. I promote it. And so if you want a copy of it and you're a local, I can give you not give, but I got copies here with me. And then if you want to order one, it's on Amazon. It's a whole long thing. I was trying to figure out how to share it. Let me see if I can copy it. I don't know. But if you Google my name, Juana Lyles, you'll see it. I promise you'll see it. Let me take it off. But yeah, I'll put the link up there too. So thank you guys so much for Nikki said she want to buy one. So, and thank you, Michelle, and thank you, Coach. So yeah, I finally got a journal out. But again, pay attention to these symptoms of depression because they are real. It's not just like where, it's severe when you're laying in the bed and you can't get up and you can't, you haven't washed your body in 2 or 3 days or 4 days, that turns into a week and you start to smell and, things like that. So it's not just that, okay, like you're grooming. It can be just like I was saying, those fluctuations in appetite, and those that just feeling tired, it could be early signs of depression. So please take the screening. Like I said, I'll put those up there as well as the link to my book. So I love you guys. I thank you for joining us. I thank you whenever you're watching for your continual support. And I will see y'all next week. But before we go, I am here. It is right now. And I am alive. God is good, y'all. Stay blessed.